Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton. And today I have the pleasure of connecting with an old friend and colleague, Dr. Elissa Diamond-Fields. And we're speaking on the topic of self-care and movement for new and expectant mamas. And we also cover, since we're both maternity and pediatric chiropractors, we cover information about infants as well, because pregnant women have babies usually within a few months of meeting us in our practice. And so we take care of the mother baby the entire time. So Dr. Elissa Diamond-Fields is a family chiropractor, mom, yogi, and health advocate. With a focus on family care, she has worked with pregnant moms and babies for over 20 years to balance their bodies and nervous systems, setting them on the right path for long-term health and function. As a longtime local advocate, she has been working with officials on improving health policies. She recently helped create a digital use posture awareness program for the local school curriculum and is passionate about improving health awareness in her community. Her practice is in Stamford, Connecticut, and you can find more information about her at drdiamondchiro.com. Hi, Elissa. Welcome to the show. I'm very excited to have you on today.
Oh, hi. Thank you so much for having me. I'm so excited to be here.
So you and I have known each other for many years. You're a colleague practicing with pediatrics and maternity care as a chiropractor in Connecticut. And we first met at a cranial seminar many, many years ago. And that was kind of my first introduction to seeing how powerful this work is for infants, right? When it comes to addressing dural tension and misalignment in the skull or cranium. And now I've been doing this work for years, and as you have as well. So today we're going to put a little focus on self-care and movement for new and expectant mamas. And, this is a topic I know you're very passionate about and very knowledgeable with all of the thousands of patients you've seen in your practice over 20 plus years.
Yeah, I came to working with pregnant moms early on in practice when I had a patient who was pretty far along with twins and had some neck pain and radicular pain in her arm. And the doctors had her on prednisone. And she came to my practice, and after working with her one session, she had so much relief, and it just got me so fired up about this population. And so I was really gravitated towards that and started studying how to work with pregnant moms and pregnant bodies. And, women go through so many changes so quickly that it's such an unsupported niche. And then obviously the pregnant women started having their babies. And so that really fueled my interest when working with the infants. And the cranial work, when we started studying it, it's just so powerful. And it was really a big eye-opening time for me because, I was a little bit confused why it wasn't really focused on in school, because it's such an important part of the spine and the system and the body. So,
I think because it's really complex, and I think that students aren't maybe ready for it.
Yeah, I suppose, right? I mean, I guess, the cranial work really in chiropractic stemmed from osteopathic work and people who were working with both. So I think that was the bridge. And it's such an important bridge. And I'm so happy that's being expanded upon right now.
Yeah, for sure. So let's talk about pregnant bodies. And you hinted at, they go through a lot of changes. I think any woman out there who's pregnant will agree with that. But let's go into the musculoskeletal and the like as chiropractors, how we can help support women in really thriving during their pregnancy and how that also impacts their birth.
Yeah, well, pretty much I'm going to say from about 18 to 20 weeks is when women's bodies really start getting going. But even before that, we come to a pregnancy with our bodies that are a product of all the years of, posture and sports and carrying heavy things and wearing high heels and all the things we do through our lives, all the impact events, all the skiing and snowboarding and, all the things we do. And our bodies are really masterful at compensating and adapting and, really creating these patterns that allow us to go throughout our day with these different imbalances that we accumulate over time. And so when we get pregnant, our bodies go through these hormonal changes very quickly. And there's many ligaments in the uterus that attach to the pelvis. So as we start growing, as the belly starts expanding, as the round ligaments come into play, all these different imbalances start waking up. And I feel like what I see is with pregnancy back pain in particular, I see these imbalances kind of coming to the surface where they're kicked over threshold, where normally your body can handle it. But now with all these big changes that are happening so quickly, our bodies start noticing and speaking. And so, when our uterus starts expanding, it can pull on those ligaments that attach to all the different parts of the pelvis. And that's where I think the issues start coming into play.
Mm-hmm. And I really appreciate actually how you talk about the body, how it existed before the pregnancy. I think that's something that a lot of people forget about. That, when you get pregnant, you're not starting with a fresh, clean slate, so to speak. There is history, there's epigenetics, there's patterns, there's the birth that you experienced as a newborn, right? And the pregnancy experience as a fetus. All of these things are going to play into what is now in front of you going into that conception and pregnancy. And it will impact how you feel, how you think, how you move. So I think that's why I'm particularly very passionate about preconception work. Preconception work is not fertility per se, where you're trying to get pregnant and it's not working. So now you're bringing in some extra support, like acupuncture, chiropractic adjustments to get pregnant, right? Like that's not the end result here. What we're talking about is really a woman doing the self-care. We can talk more about what that looks like. Self-care before she gets pregnant to really have a really healthy vessel, and healthy genetics in her eggs, and ideally her partner also healthy sperm, that then when the conception occurs and now her body is the vessel creating this life, it's optimized, right? Because of the work she did before she got pregnant, not to get pregnant, but to get pregnant with a healthy baby and a healthy pregnant body.
Yeah, we see the same exact thing in my practice. And we actually do have quite a growing amount of people who are coming in looking to optimize their bodies before conception, because that's now kind of in the ethos. And a lot of people doing detoxes and, the men and women both.
Yes,
and
definitely detoxes. Are you talking like 3 to 6 months before they start trying? What is your recommendation?
It varies person to person, but the sooner the better. If you're going to start next year, start now. Why not start cleaning up? We are a product again of the years of stuff that we've been doing. And I always like to say I spent my 30s and 40s undoing my teens and 20s because, when we come into awareness of just being really more conscious, right, of what we're putting in our bodies and what it creates and how things move out of our bodies. And when we're optimizing for pregnancy, it's optimizing the whole hormonal system, right? And not just the structure, not just, but we're creating this house for this baby to grow. And so, the more balanced the house, the, obviously better path we're going to start that baby on.
That's completely right. And I love that you're seeing more of that. I am too. I think part of it also is actually coming from social media. I see more and more people in their 20s and 30s who are active on Instagram or TikTok, and they're learning about chiropractic. They're learning about health. They're learning about how to take care of themselves. And, you and I are in the same generation. This is not something that we grew up with, right? We really learned from our parents about, and these people also, of course, learned from their childhood of what health was, but now there's an awareness. Well, maybe there's more to them that maybe like when I don't feel well, taking over-counter the medication or going to the doctor immediately to treat my symptom is not necessarily the best route. And here's all this tools that I can have at home to support my body in healing. And recognizing that, even over-the-counter medications have side effects and toxicities. Preconception and certainly during pregnancy, I was just learning about the dangers of acetaminophen during pregnancy. And this is a big thing because I still sometimes will hear OBs like, okay, you're having back pain, take acetaminophen. And I just really want women listening to recognize that this is not a good option to take for your musculoskeletal pain. There's so many other things out there that are safe during pregnancy, chiropractic being one of them, that are going to be effective and safe. And that does not include acetaminophen.
Yeah, a lot of people don't know. And so for those who don't know, acetaminophen is Tylenol. And it reduces your glutathione, which is one of the master detoxers in the body. So again, right, while we are pregnant, we need to be all the more cautious about everything we're doing with our body. And I think that goes for children too.
Yes, it does go for children.
Is often recommended with children. And the last thing you want to do is stop their detox pathways. And acetaminophen, as an aside, does not apparently stop pain in children. It only is really a fever reducer, from what I understand. Which is interesting. Yeah.
That is interesting. And even, since we just started going down this rabbit hole, fever in children is really nothing to be afraid of, right? And this is something that, women that are listening that are preparing to become moms or already gave birth should recognize that we have to look at the appearance of your child as a mom. Really listen to your intuition. Don't focus on the number on the thermometer. If your child is very listless and really looks like they're not feeling well, then that's time to call the pediatrician. But if your child is talking and moving and babbling and eating and peeing, then your child, they could be hot, but you're going to support them. You're going to love them. You're going to make sure that they're hydrated, and their body's going to process this fever in a healthy manner. That body creates fever for a reason, and it's a positive reason. And this is something that we need to not interfere with fever reduction. So that's one thing I know people get very nervous about fever in their child and, want to treat it. Right. And I get it. It's not fun. It's hard to see your child uncomfortable.
It's also hard to do nothing.
It's right. So, but you can do something, right? You can give them maybe some bone broth, if they're over 6 months old.
Skin to skin, breastfeeding.
Yes.
Yeah. Dr. Larry Pilevsky has a wonderful chart on his website that talks about fever and when it's time to take measures.
Take action.
Mm-hmm.
Yes. And I think that's important. So it's not saying that you never need to involve medical treatment, obviously, but less is more. And it's really being, I think, very empowered as the parent and mom here, that you are really feeling like you understand when it's the right time.
Right.
And
it all comes back to trusting our intuition and paying attention to our intuition, and really, you know your child, and you don't treat the fever, you treat the child, I guess, is the adage.
That's right. So it is. It's, I think that's one of my biggest passions, is empowering women during the pregnancy, and then as they become mothers, to really tap into their intuition regarding every decision you make for your child and for yourself. And that includes the foods that you put in your body. It includes the birth provider. It includes where you choose to birth. But it's really making these decisions consciously and from a place of education and information and not fear. And even back to like fever, it can be scary, right? But if you've done your research, then you're like, I know how to respond to this, and I know what I need to do, instead of kind of getting caught up in that fight or flight, we're all going to die type of mentality, right? Which is a real thing. I'm seeing, obviously, even now with COVID, and some of the moms in my practice that are having a lot of fear. And, I just go back to like, well, is your child healthy? Yeah, my child's healthy. So I'm like, there's, you don't really have to be afraid of viruses, right? And bacteria.
Yeah. This is a rough time to be pregnant for a lot of women.
And
There's a lot
have
of
a small baby at home, right? Yeah.
yeah, there's so much fear being pushed on top of a tender time. And I think that women are even more susceptible to the fear coming at us when you are growing a baby and getting ready to bring a new life. So it's a tough time. Um, but I think you've got it right. We need to focus people back to, just going into their intuition and really, understanding the power of our bodies and the power of our children's bodies to be healthy and to heal. And that, we're not going to be taken down by the microbes that we are living in harmony with, throughout our bodies.
That's right. We have the microbiome that we've recently, I know it's been over 10 years, I think, that the microbiomes, but recent enough where it's like the germ theory is like not quite dead yet. And the pandemic brought this, theory that's been disproven back to truth. I'm like, no, it's actually not true. We don't get sick from germs, right? That's the bottom line. It's
they're
the terrain. They're there.
Right.
They're there all the time. We're covered in viruses, bacteria, parasites, and yeast. And so they're not the equivalent to symptoms and disease, right? So
right. And when
that's
do we
powerful,
get sick, right? We know. I mean, when do we get sick? When we're run down, when we're not getting sleep, when we're not getting exercise, when we're stressed out, when we have fear, when we're just burning it, and we know
we're burning it. So let's talk about some positive self-care practices that a woman during her pregnancy or after birth can do to nurture herself and therefore nurture her child.
Yeah. I mean, I've personally been just loving exploring all these different healing modalities over the past 20 years and taking from each one. And, for pregnancy specifically, my favorite two, I'm going to say, is yoga and meditation. They kind of go together. But for yoga specifically, I don't think there's any other modality that gives you more bang for your buck as far as getting movement throughout your body, getting movement throughout the spine, washing out the organs, detoxing the body, getting the lymphatic system moving and cleaning the garbage out, and quieting the mind. I just think it's a lot of bang for your buck if you're going to pick one.
Mm-hmm. And specifically like a prenatal class, right? That's modified.
I think absolutely. Get a prenatal class. I mean, there's even so much now available on YouTube and all sorts of online prenatal
Peloton.
Yoga. There's so much now at our disposal. If you've been doing yoga for a while, you can mix the prenatals with other types as long as you know how to modify and know not to do closed twists. And but there's a lot available, and now that everything has been done remotely in the world, I think we can access it, even if we have very little time.
Yes, it's accessible. You don't have to even live near like a city that has a studio, that's conveniently located to your home. You can do it in your house. You can do it. They have like probably shorter classes, maybe 30 minutes to fit into a busy mama schedule. There's something to be said with the in-person experience as well, right?
Yes.
In the community,
yes,
connecting with other pregnant moms. If you have that option as well, then I think that's a huge blessing. It's nice to be around other pregnant women and connect with them. Because, it can feel lonely, right? To go through this process if you like maybe your friends or sisters aren't pregnant at the same time. So, that's nice to meet other women. Go ahead.
Community is a really important thing. And I think that's been one of the big stresses over the pandemic with pregnancy is they haven't been able to do that. And new moms going through the new mom thing and not to have the moms groups, that's a big part of nurturing ourselves is having community and having, our people around us.
Did you know that there's an organizing app designed just for families? If you're starting to feel busy again, and I know I am, and your calendar is jam-packed with events and kids' activities, why not do yourself a favor and get Cozy? Cozy is the #1 organizing app that families use to juggle school schedules, practices, meetings, doctor's appointments, and even a workout or date night. With Cozy, you'll be all set up to know everyone's schedule, who's doing what, when, and where. And Cozy will even send emails every morning with the day's agenda. No more missed pickups or double bookings. Here's how it works. Cozy tracks everyone's schedules and events in one place with a shared, color-coded calendar. Cozy even reminds others about events so you don't have to. It's easy to get started. You can pull in events from your family's personal work and school calendars. And the best part, it's free. Just download Cozy Family Organizer from the App Store. That's COZI to get the free app today. I know I've been using it and I absolutely love it.
Yeah, that is self-care. In my town, was a very large new moms group that was hosted at the hospital in Hoboken, and I would speak quarterly there. I mean, there would be like 40, 50 moms there with their strollers every week. And it was just beautiful. And these moms, were then going out to lunch afterwards and making friendships that lasted for years, right? Because their children were the same age and they were growing up together. And it was just really beautiful. And then now in the past couple of years with the pandemic, the group is virtual. So at least it's still meeting weekly, led by the lactation consultant at the hospital. It was amazing. And so I've popped on a few times now, and it's small. The women, it's maybe 10, 15 women max, much smaller than when it was in person. And these women are still able to connect and share and get guidance. But I can see why, especially as a new mom, if you don't make that effort to get out of your house and get your baby and your butt dressed, it's like a lot of work those first few months. And you don't make that effort, I'm going to show up at this mom's group. Then it's like you're at home and you're like, I'm not going to log in. What's the point? Right. So I think probably, we even see this with college students. There's an increase in mental health, issues. And this is all based on isolation and lack of connection. This is a basic human need. So I think the other thing I want to share with self-care is make a point to connect to other women, other adults, especially if you are a new mom, go to the store, make eye contact with these strangers, just, small talk, just something, because we need that as humans. We need those connection, and we can't just connect with our baby. We need more.
Yeah, for sure. And I'm hoping now that things are kind of easing up, and as when spring starts coming up, which I'm sure, these weeks have been flying by so quickly, maybe some more outdoor classes will start reconvening, and the stroller strides. And there's quite a few new mom-based classes, at least in my area in Connecticut, that they used to do. So I'm hoping that kind of reinvigorates, because that will also give you, right? We have the movement piece of it and the community piece of it. Yeah.
Yeah, that's great. So yeah, you're right. For new moms, there's these stroller classes. There's workouts with baby as your weight, right? And that is nice, because then you're getting your workout. It's a postpartum exercise also needs to be, modified, right? Because your body is still healing and recovering after the birth. I mean, I feel like it takes at least a year.
Yeah, I always say it's, 10 months in, 10 months out, but really it is a year. Yeah, I agree.
Yeah. So, even though at 6 weeks postpartum, your doctor gives you the clearance to going back to working out, this is not going to be the workouts you did pre-pregnancy, right? That were maybe intense and powerhouse and jumping and, let's let your pelvic floor heal. Let's let your joints heal. You still have some hypermobility from the relaxin hormone.
Sure.
So we don't want to, there's more risk of injury and strain if you're doing exercises that are more intense and high impact.
Yeah, for sure. You definitely want to keep everything, really starting off slow and listening to your body and feeling your body. You give birth, you're going from however much you gained in this pregnancy, say 30 pounds, within a 2-3 week period, you're dropping 10, 20 pounds.
Yeah.
So that's a massive, massive change for the body. And like you said, the ligaments are still quite loose from the relaxin, and that takes time. I call it bag of bones, right? After we give birth, we're pretty much a bag of bones for a while. And so we need to be really kind and gentle with getting that knitted back together, and just, it's always listen to your body, right?
Always. And I think Yeah, it's hard because there's sometimes this pressure culturally that we put on ourselves that we're like, oh, I have to get my body back. I have to lose this weight. I want to get my, I want to look sexy again. I want to get back into my jeans, whatever it is. And, it will all come, right? Like these are good goals to have, but they don't have to happen tomorrow. We can get there slowly. There's no rush with this. There's no sprint. If we go too fast, I think that's really where, the injuries can occur. There's also the whole component as new moms that there's sleep deprivation. So our bodies will also heal slower if we're not getting quality sleep. And that's okay, because that's where you're at with the newborn stage. But that's just, gentle and slow is definitely the motto there.
Yeah. And that leads to another piece of the self-care puzzle, which is having grace with ourselves, as a new mom. And we do live in the society of supermom. Like, we got to get our bodies back in shape, got to get back to work, got to get back to our life, and do it all and raise a baby and juggle it. And the truth is that, we do need to have grace with ourselves, and we need to know that it's okay to say no to these different, and I think, COVID really highlighted that for so many people too, the right to say no and to, not have all of these activities and all of these obligations. I
would agree with that. We all slow down.
Yes. And got to take inventory of what's important. What do I really need to have in my life? And, is it okay to say no sometimes? And yeah, it really is. And other people are accepting it more.
It's important, and it's healthy. And it is about really like, what's your priority? What's important to you? Not feeling guilt of I should do this, or, what are people going to think of me if I say no? What is the shame? It's just like, no, this is where I want to spend my time. And the other activities that are taking your time away from where you want to spend it are no longer needed. And I think that's the other thing, as women, we're going through these transitions, right? So maybe that volunteer activity really was fulfilling for you as a single woman. And now as a mom, it can be put back to the back shelf, right? And maybe you'll come to it when your child's in college. You know what I mean? Like and that's okay. Like, we don't have to continue to maintain that same level as we're bringing in these additional, duties. And, it's because then that's recipe for burnout, right? So what other types of self-care activities do you recommend for women?
Yeah. So
talk about meditation, which I know is sometimes part of yoga usually, but.
Yeah. So I got really into a kirtan kriya meditation about 4 or 5 years ago, which I love because it's such an easy, it's an 11-minute meditation. And sorry, my ears are popping out here. And it really also hits a lot of things at one time. It gives you a lot of bang for your buck if you've not really been able to get into meditation. It's a real simple sata nama mantra, but you're using both of your hands at the same time. And you're singing for 2 minutes out loud. You're whispering for 2 minutes. You're silent for 3, whisper for 2, out loud for 2, and then you're done. And what that does, doing all of those different things, it really helps you to quiet your mind because you're doing all these things at one time, but also because you're using both hands at the same time, you're balancing both sides of the brain. You're also using your voice. So you're bringing the energy up through your body and opening your energy channels. So it just gives you a lot of different benefits at one time. And, as a New Yorker, grown up as a New Yorker, I'm all for, get as much bang for your buck as you can. And, especially when you're a mom or pregnant, your time is not always, you don't always have a lot. So 11 minutes is something you can really do. And once
it's doable. I think everyone can commit to 11 minutes a day practice. I always strive for 20. But so how can women find this meditation?
Yeah, so you can just look up Kundalini Kirtan Kriya meditation. So that's Kirtan, Kirtan, Kriya, 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 or YIA. And just on YouTube or Spotify, you put in 11 minutes and it'll come up. There's one that's 33 minutes as well. And once you start doing it for a while, I took away the recording and I'll do it on my own for as long as I want. I also add some breath work in during the silent part. There's a lot of different things you can do with it, but yeah, you can follow along on YouTube. There's a bunch of people, and that's a great way to get started. And they do say to try to do it for 40 days. And if you miss a day, start over. So as hold yourself accountable.
You're creating a new habit.
Mm-hmm.
I love that.
It's been really
do find amazing. Yeah, there's an app out there, Expectful, which is all about meditations for fertility, pregnancy, and new moms. And, if you're new to meditation, it can be overwhelming, I think, to do it on your own. So having these apps or, like you said, even YouTube, is something to guide you is very powerful until you kind of get your rhythm, and then you can go from there. But it is about creating these new habits and it's committing to it, right? As like you brush your teeth every day.
Yeah. I mean, at this point, it's been about 4 years and I'm not, perfect 100% every day, but when I go for a little while without it, I miss it. And I feel it. And especially going through COVID and just the intense world that we've been living in this last 2 years, it's been such a great tool to have to just bring the nervous system down. And, and that's really what are we doing with these self-care, different modalities is we're really trying to tone our nervous system and keep it at this level keel and, with that balance between fight or flight and rest and digest. We're always kind of riding that wave. And so the meditation, the yoga, even the chiropractic, acupuncture, all of these wonderful modalities, at the end of the day, they're helping tone the nervous system down. And that's where
they really are. And really what that, to me is just like get us out of that fight or flight, right? Oversympathetic, and increase our parasympathetic nervous system, which is the rest and digest, and create some balance there because we need both parts of our nervous system. But we don't want to be kind of too high in either way, right? So toning is that balance between both parts and having, I think, also people that are feeling anxious, and kind of on edge. And it's kind of like, they're like, they'll even be like consciously like, I don't understand why I'm anxious. Like I don't have anything to be stressed about, right? Like my life is good. I'm not like starving and I have a house and I have like everything I need. So that's also really important to recognize, like the nervous system is trying to give you information that, your nervous system still does not feel safe, bottom line, even though your exterior world and logically you are safe. There's not a tiger chasing you at this moment. Your needs are all met. So, for somebody who's feeling that way, and this is really, I think, important to look into preconception as well, because going into pregnancy and motherhood with that history is going to put you at much higher risk for postpartum depression and anxiety, right? Because there's that pattern. So, I find that's very much related to the subconscious mind. And meditation can help with that. Any other suggestion about helping people who have this and maybe even are on medications for anxiety or depression?
Yeah, I mean, there are so many things, but I think number one is turn off the TV, turn off the news. It's good to get the news. You want to flip through the newspaper or flip through stuff online, but actually watching the news and network news, it's a constant barrage on our nervous system. And if people are not really aware of that, or you're not paying attention and you have it on in the background, that's gonna feed into your nervous system. And
it's going to make you feel anxious. You're not going to feel safe.
Right. Well, that's it. Right. And again, when we're talking about subconscious, it's just getting in there. We have it on in the background. And it's it's a real invasiveness into our consciousness. So that's number one, I would say, especially these last 2 years, just turn the TV off.
I've been recommending that for years for pregnant women, even way before the pandemic, because I just find like in general, the news is not positive. And as pregnant women, you really have to protect yourself energetically. And all the negativity, the negative birth stories, the negative news, that's not your problem. And you don't need to listen to that. That's somebody else can listen to that. But somebody's having, stress and they want to vent to you, have them call their therapist.
Yeah, it's so true. Because we are so tender during that time, and we're also so much more in tune, to going in. And so we're just much more susceptible. And, along with that, I would say the, shutting our routers off in our house sometimes, and putting our phones into airplane mode, and not sleeping in a room with a router, and just being conscious also of the electromagnetic stuff that's going on around us, the Bluetooth earbuds in our ears, just being conscious of that kind of stuff too, because that also affects our nervous system and we don't even realize it, right?
It really does. And that's just been getting more and more powerful, right? With the 5G, it's getting cranked up and it's invisible, right? We don't see it, but it's very much stressing our nervous system. So yeah, I always, I keep the phone, at least 6 feet away from me when I'm sleeping. You don't want it right on your nightstand next to your head for hours, right? You don't want to wear your phone on your body.
Take the watch off when you're sleeping.
Yes. I know people are like, oh, it monitors my sleep. And it's like,
You're attached to
well,
Bluetooth.
right. It's also impacting your sleep, right? So it's like, there's information. I mean, there's some new technology I just recently discovered called Soma Vedic, which you can set up in your home and it helps to protect you from EMF. So there's some really cool technologies that exist out there now that are protecting, for me, like we're not going to turn off our router because that's controlling our thermostat and everything else, but it's in the basement and, I don't have a TV in my bedroom and I'm still fighting with my husband to get his phone out of the bedroom, but he hasn't agreed yet.
I make my husband put it in airplane mode, so at least you got that.
Oh, that's not a bad idea. Yeah, because it's like, while we're sleeping, we don't need the emails, the texts, like whatever's coming in during bedtime, it can wait till the morning.
Yeah.
And
it's small baby steps, right? It's, just little changes you can make in all these different areas, and the same thing with movement, same thing with meditation. We just pick one thing and start there. Make it small,
yes.
Make it doable.
Yes. Don't get overwhelmed. We gave tons of suggestions today, but you just pick and choose what works for you, what feels right. And it's great to be open and you try it and, maybe it resonates with you. Maybe it doesn't. Sometimes you might need to try it a couple times for it to really click, but I think the other thing is this is not about perfection where you have to do everything. Self-care can also become this like, oh my God, I have to overschedule. At least that's how I was a few years ago. I would schedule my self-care where I was like constantly running for self-care to self-care to self-care. And then I was like, wait a second, this isn't really helping my nervous. I mean, it's like, there's a balance there. Scheduling time to do nothing, right? Scheduling time to just like go for a walk in the woods and, just connect with nature, not be on a schedule, scheduling time to just be free, right? And that you're not like, oh my God, I have to rush to this meeting or,
We love the snow days for that reason.
The snow days are such a blessing, right? It's just like, they just make us just chill out at home. And yeah, I mean, I guess that's one of the beauties of being in the Northeast.
The blessings and the curses.
The blessings. Yeah. So awesome. Do you have any last thoughts you want to share with the audience?
I do want to, just share that trying a modality that you haven't tried might be a really nice way to expand your self-care. So it's something that you might have wanted to try that you haven't tried, whether it's chiropractic, whether it's acupuncture, whether it's yoga, whether it's meditation, or some other form of craniosacral therapy, whatever it is that you've been kind of interested in, go for it. Give it a try. Try something. It's only going to expand your understanding of your own body, and and how to focus in on yourself. And I think that's where growth happens, and where healing happens.
It really does. And I think, sometimes during pregnancy, women have a fear of trying new things, but like, especially if it's, the practitioner is highly recommended by a friend or somebody that, and trust, then, give it a try, I mean, everything you just recommended are all safe during pregnancy. So, that's important. Massage also, I would put in there.
Yes.
So
and
these
looking for
are,
practitioners that do focus on those areas. I think pregnancy is a really great time to try these things, because the practitioners that focus on prenatal and postpartum care, it's often a little bit of a gentler entry into those modalities. So it's even, I think, a nicer time. And I think during pregnancy, it's not a luxury to nurture yourself. It's a necessity.
That's right. It's worth every penny that that you invest in it. So wonderful. Well, Elissa, thank you so much for coming on the podcast today and sharing your wisdom and knowledge.
Thank you so much for having me.
So as you heard from today's episode, Dr. Elissa and I are both quite passionate about supporting women through the entire perinatal phase of their journey, which includes preconception, meaning actively supporting women and men in preparing themselves physically, mentally, emotionally, and spiritually for creating a healthy baby, healthy pregnancy, and an empowered birth experience by doing the work several months up to a year prior to actively trying to conceive. Not only do we find that it's usually much easier to get pregnant, women feel good during their pregnancy, they have less common pregnancy symptoms, and they have a different type of birth outcome. So if you want to learn more about how you can support your own health and body with preparing for a healthy pregnancy, check out my online program at drlaurabrayton.com under Brayton Birth Method.